Thank you very much. I'm really pleased to actually be here to get the graveyard slot, so apologies for that. Can I ask, those of you who are leaders, will you stand up, please? Okay, we've got some people who are still sitting down. I'd say that we are all leaders. Please take a seat again. Can I ask those of you who make a difference to patients, whether that be strategically or whether it be in clinical practice, to stand up, please? Okay. Lovely. Much more people, many more standing up. Great. I'll sit down. And my last question, just to get the blood flowing. How many of you make a difference to the culture of the NHS? I think we've got almost everyone standing up, which is really, really fantastic. Because I do believe that we are all leaders, that we all have an impact on patients, and that we are the culture of the NHS. If we want to change things, it's within our gift. But one of the critical things for me is that if we are so influential in making change happen, we actually need to look after ourselves and each other. Self-care is so, so critical. If we look after ourselves, we can actually work with our patients and their families so much more effectively. I'm a children's nurse by background, as well as an adult nurse, and a play specialist and an A&E nurse, provided great mentorship and coaching for me. And the play specialist particularly gave me a poster. She didn't read it to me, she just handed it to me and said, "Pop it on your wall, Kath. Look at it when you need to." And it's care for the caretaker. Be gentle with yourselves. Remind yourselves you're an enabler, not a magician. You cannot change anyone else. You can only change how you relate to them. Find a hermit spot and use it daily. Give support, encouragement, and praise to peers and management, and learn to accept it in return. Change your routine often and your tasks when you can. On the way home, highlight one good thing that you've achieved that day. Be a resource to yourself. Get creative. Try new approaches. Use supervision or a buddy system. Schedule withdrawal periods. If you never say no, what is your yes worth? Laugh, play, and have fun. I thought those were really, really wise words, and I've used those throughout my career. I also think that there's something really, really valuable in appreciating the good stuff. Appreciative inquiry, celebrating, recognising what's really working. It's been lovely to read the scenarios and the narrative of where real engagement is significantly making a difference to patient-centeredness. We need to get much, much better at appreciating the good stuff within the NHS. This is Adam. I would say that Adam is probably one of the most engaged and activated patients that I know. Certainly his family are incredibly activated. Adam's got a tracheostomy, and Adam's been in hospital for the last year. They've been unable to actually get his complex care package sorted. Adam doesn't speak, but he communicates via blinking, and he blogs. He blogs very, very effectively. And at 13, he wrote about what good care looked like. Consider just how long these words will have taken Adam to actually share with us. In good hospitals, staff talk to me. They involve me in decisions about me. They ask me what I want and what I don't want. They talk to mum and dad, and they ask them about me. They talk to each other, and they pass on information as well. If they don't know something, they're not afraid to ask. They treat me as if I'm an individual. They recognise the things I can do, and they don't jump to negative stereotypes about the things that I can't. Staff have time for me. They're friendly, and they're chatty, and they make me feel as if I matter. I'm never left alone when I'm seriously ill, or in a room with the door shut so that staff can't see me. When I'm really ill, the doctors come quick. And I feel as though I'm getting the best care possible. I never am made to feel as though I'm a second-class citizen, for whom it doesn't matter if I live or die. In the bad hospital, they do the opposite to all of this, and worse. That's why I never want to go there again. Adam, for me, very eloquently shares why it's so important that we all work together to put patients at the very, very centre. Adam is just one of 12.3 million children and young people across the whole of England. How are we involving them in our approaches? In East and North Hertfordshire, we've now got 650 young health champions, peer mentors, young people spreading health messages and supporting each other. How are we progressing that agenda? Shropshire Clinical Commissioning Group now have a whole programme of investing in young people as health champions. These are really exciting times for thinking and doing differently. And yet, there are stories like this where we would really question ourselves and think, perhaps we can do better. Victoria, Daniel, Peter, Lucy, opportunities for us as healthcare professionals to think and do differently. And this is just a very short clip just to bring this to life.
See where I live. See where I sleep. See what I eat. See where I play. See my teacher who doesn't see me. See where I fall. See the doctor who says everything will be alright. See where they put me when I've been bad. See the social workers trying to get in. See where Mum pushed me too hard. See the ambulance that comes. See the policeman. See the neighbours' flowers. See the news. See the politicians blaming each other. See the inquiry they order. See their report. See where it goes. See it happening all over again.
I think we've got lots of opportunities to think and do differently. And one of the ways that we can do this is by getting creative. This is a piece of graphic facilitation, slightly different to the wonderful style that we've actually seen here today, that we've actually been using in maternity services to bring families together, mums, dads, babies, with professionals, with support workers, so receptionists, the ambulance staff, as well as obstetricians, to think about how do we improve maternity care together, creating conversations that are really transforming practice. One of the things I really enjoy, particularly when the Wi-Fi actually works, is social media. How many of you have got a Twitter account? Quite a lot, actually. So, can I ask those of you who'd say that you're in denial about Twitter and social media, stand up? Nobody's in denial. No, everyone's in denial, and nobody's in denial. Fantastic. Anybody curious? Stand up if you're curious. A few. Oh, excellent. Great, some curiosity. I like that. How many of you are going, aha, it offers potential? Excellent. Good. Okay, this is where I'm already standing. Who's obsessive? Where's Pete? Anybody else obsessive who's prepared to actually admit it? Thank you. Excellent. And actually, Pete, I think you can stay standing. Anybody for who Twitter and social media is part of daily life? Oh, excellent. Lots of people. Fantastic. Did you know that actually social media is probably 14 times more effective at actually disseminating and spreading information than the written word, best practice databases, and toolkits? So as we go forward in terms of our communication strategies and our resources and our frameworks, we need to be talking about it. We need to actually be engaging not only with other professionals and executive team members and managers and commissioners, but also with the public as well, to actually bring them together with us on our journey, or to follow Pete, who's already actually leading us so brilliantly on this agenda. And actually, social media can really help to engage staff right across the NHS and the public. Because if we're going to make a change in terms of collaboration, co-production, really transforming the future in terms of partnership in care and addressing what really matters to our users, we need high levels of engagement. Thank you. Great. So the evidence tells us that actually we need new communication strategies. We've actually got the old world, or the real world actually, of the NHS culture, where the rules are there. Still, doctors are actually there saying, you know, we know best. Yet the online culture and what we're seeing in social media are real conversations between professionals, between the public, visible leadership, demonstrating that collaboration is working, that blogs such as those from Adam are making a difference. Blogs from people about their appalling experiences of miscarriage and loss experiences are beginning to transform practice. And a real feeling that we are all leaders as we go forward. So professionals then, I think we can all consider our own professional interactions. Taking care of ourselves is absolutely critical. But it's also critical that we recognise, we celebrate, and we appreciate the good stuff. And we have heard so much of it today. We need to be continuously interested in people. The public are assets, real assets. And we need to be clear about our priorities. We need to plant those seeds. Repeatedly, our black and minority ethnic communities are telling us they are having poorer experiences of care. How are we tackling this? So importantly, we need to be ready to listen. It was J.K. Rowling who highlighted, no story lives unless someone wants to listen. Together, we can all make this attitudinal shift. We need to have that belief in potential, high expectations, and also we need to embrace new communication strategies. Because actually, our public are willing us on. And that's what we need to think about. Yes, we can. We can change the future in our approaches if together we collaborate. Thank you.